The red flags and warning signs of sex trafficking right in their own ERs. Medical professionals are now successfully spotting victims through new training developed in Sacramento.
I'm incredibly happy with how well the training has worked and the success that we've seen.
Now, we first shared this Dignity Health program with you 8 months ago, and tonight we wanted to check in on its progress in fighting human trafficking here in Sacramento.
New tonight, CBS 13's Sharon Roger is live from Dignity Health Methodist Hospital with a closer look at this. Sharon?
Christina and Tony, it's pretty remarkable. Since our story last aired in May, 10 human trafficking victims have been identified and saved because of this training, and dozens more system-wide.
Our residents now routinely identify victims.
Sacramento family physician Dr. Ron Chambers has helped develop a specialized training that's being rolled out throughout 39 Dignity Health hospitals aimed at identifying human trafficking victims that come through their doors. And that training is now turning into success stories.
We identify them in the emergency room, on the labor and delivery unit. They've identified victims in the ICU that are intubated because we know the tattoos to look for.
Tattoos are one of those telltale signs they are trained to look for.
There's different words that they use, symbols, in prominent areas on the neck, on the arm.
Other parts of the training deal with recognizing certain mannerisms and behaviors.
Maybe somebody that's, texting constantly during a genital urinary exam, that's odd, and that can be a control mechanism that their pimp or trafficker is using.
Since my last interview with Dr. Chambers, he has taken this training to 8 other hospitals throughout California.
At St. Mary's over in San Francisco, in less than a week, their residents identified 2 human trafficking victims.
And the success is not only in the training, but the quality of care that follows through Dignity's Safe Haven Clinic as part of their road to recovery.
How to have them open up to us, how to make them feel comfortable and safe.
Just in this past year, more than 100 victims were taken care of in this clinic, painting a grim picture of how big of an epidemic this is right in our own backyards.
We need awareness. We need this model of care to spread, and so that's really a big part of what we're trying to do.
Now, Dr. Chambers says they're just scratching the surface of this issue here, but his goal is to spread this training through residency programs throughout the country.
Making a difference. Looks like the project is working. Sharon, thanks.